Antidepressants are one of the most prescribed types of medications in all of America. According to a 2019 CDC report, antidepressants were the fourth most frequently mentioned medication at doctor's visits, coming in just below vitamins. So I looked at the types of antidepressants given and the pharmaceutical companies behind them, the effectiveness of the medications, their side effects, and why they are prescribed so readily. The amount of people taking antidepressants is truly staggering, and honestly, just thinking about the whole situation just makes me feel sad. Biscuit Demon, what are you doing here?
You seem down, and Biscuit Demon is here to cheer you up.
I could always count on you, Biscuit Demon. Wait, where's that music coming from?
You know what I do when I'm feeling low?
What?
I take a big chunk of Lexapro, some Celexa to ease my pain, a few Prozac to balance my brain.
But aren't some of those contraindicated?
You're making Biscuit Demon awfully frustrated.
Do any of these pills even really work?
Who knows? Probably not, but they can't hurt.
Okay.
A is for amitriptyline, B is for bupropion, C is for clomipramide, D is for duloxetine, E is for...
Cookie Monster?
You mean Biscuit Demon?
Yeah, sorry, Biscuit Demon. All of these drugs are starting to scare me.
Don't you worry, it's cheaper than therapy. Some Effexor to fix your core. You can find all of these at your local drugstore. Your brain's a broken car, you better fix your axle. Try a Paxil, a half-pill, the Maxi-Reaxil. The Paxil make you wanna take the capsule. Lucky for you, I have a pack full.
But I'm still sad and I wanna die.
Well, just take more pills and you won't cry. Trust me and try Zoloft yourself, so you don't go ahead and try to off yourself.
But my vision is blurry and my legs are jerking.
Don't worry, that just means it's working.
I'm drowsy and having feelings of unreality. Weight gain, nausea, increased suicidality.
That's okay, a small price to pay to feel mildly content at least once a day.
I feel like I'm muted and the world is gray.
That's perfectly normal, as the doctors say.
Okay. Antidepressants are one of America's, nay, the world's, favorite drugs of choice. A recent study from the American Academy of Pediatricians found that in America alone, over 221 million antidepressant prescriptions were dispensed to over 18 million individuals, with 64% of those individuals being young adults. 67% of these antidepressants were SSRIs, selective serotonin reuptake inhibitors, which work by limiting the reabsorption of serotonin in the brain, giving you more serotonin and, in theory, more happiness. The three most popular antidepressants are sertraline, sold under the brand name Zoloft, fluoxetine, sold under the brand name Prozac, and escitalopram, sold under the brand name Lexapro. But while antidepressant use is high in America, this is a global phenomenon, with Iceland being a particularly sad place to live, according to this rank list provided by the OECD. I guess at least the US isn't the biggest consumer of antidepressants. Just kidding, the OECD just hasn't included them in their list, and if it had, the US would be at the very top. Note that this data is 7 years old, so these numbers have all skyrocketed, by the way, especially among teen girls and young women. The use of antidepressants by teens and young adults of all genders rose by an average of 63.5% from 2020 to 2022, and a whopping 129.6% for teen girls aged 12 to 17. But surely antidepressant use isn't the problem. People take antidepressants because they're, well, depressed, and they want to be anti-depressed, which is valid. According to basically every developed country's clinical practice guidelines for treating depression, antidepressants, namely SSRIs, are seen as first-line treatment because of their comparatively low side effect profile, their affordability, and their effectiveness. Wait, this doesn't say effectiveness. They are effective, right? Right? Oh, fuck. Oh, fuck. Oh, that's not good. Surely these are just over-exaggerated titles, though. Well, according to this study, meta-analyses of antidepressant medications have reported only modest benefits over placebo treatment, and when unpublished trial data are included, the benefit falls below accepted criteria for clinical significance. According to this study, although antidepressants are regarded as effective in specific treatments, they're barely superior to placebo in randomized trials, and differences are unlikely to be clinically relevant. And according to this study, antidepressants are supposed to work by fixing a chemical imbalance, specifically a lack of serotonin in the brain. Indeed, their supposed effectiveness is the primary evidence for the chemical imbalance theory, but analyses of the published data and the unpublished data that were hidden by drug companies reveals that most, if not all, of the benefits are due to the placebo effect. Hidden by drug companies? Well, that's sketchy as all hell. Who makes these drugs? Well, we already mentioned the three most popular, Prozac, Lexapro, and Zoloft. Prozac is the brand name of fluoxetine and is made by Eli Lilly and Company. Lexapro is the brand name of escitalopram and was made by Lundbeck and Forest Laboratories. Zoloft is the brand name of sertraline and is made by... on second thought, let's not talk about that one. But I will point out that 2 of these companies are in the top 5 list of the biggest pharmaceutical settlements of all time, both paying billions of dollars for various malfeasances for multiple drugs. Comforting. Lundbeck was also sued over citalopram, sold under the brand name Celexa. Eli Lilly settled 30 cases for a combined settlement of $50 million over Prozac. GlaxoSmithKline lost $1.14 billion when it settled 800 lawsuits regarding Paxil, and Forest Laboratories settled for $313 million when it was sued for giving paid kickbacks to physicians if they prescribed Lexapro to fucking children. Kill me. So is there a massive incentive for drug companies to push these drugs despite knowing their ineffectiveness? Well, in 2005, the year before Zoloft's patent expired, It Who Shall Not Be Named made $3 billion off this one drug in a single fucking year. So, the answer is yes, there is a massive incentive. According to the company who made Zoloft's financial statements from 2005, Zoloft was its 3rd best-selling drug in terms of revenue, as it also was in 2003 and 2004. There is a lot of money to be made off depression, and that's fine if the drugs actually worked. But as it turns out, they mostly don't. If you search through the available psychopharmacological literature, you'll find conflicting results. Some studies show no difference between placebo and antidepressants, others show a marginal effect, and others seem to show at least some benefit. This study puts the situation quite succinctly. Overall, randomized controlled trials show that depression ratings decrease slightly more with antidepressants than placebo. Studies are inconsistent, however, and differences are small, especially when unpublished trials are included. Reviews of the literature on tricyclic and older antidepressants concluded that, in well-designed studies, the difference between antidepressants and placebo are not impressive. Meta-analyses of trials of selective serotonin reuptake inhibitors and other modern antidepressants that include unpublished trials have found mean differences between antidepressants and placebo ranging from 1.8 to 2.55 points on the widely used Hamilton rating scale for depression. Now, 1.8 to 2.55 on the Hamilton rating scale for depression, let's give that some context. The Hamilton rating scale is used to determine just how down bad someone is across a wide variety of metrics to eventually land on one number to truly quantify human suffering, the miracle of science. This rating scale scores patients on things like insomnia, agitation, anxiety, and other things. There are 17 criteria clinicians use to rate someone's severity for depression for a total possible score of 53. So a difference in 2 points could be going from being a bit restless during the night and taking 30 minutes to fall asleep to being not restless at night and falling asleep in 20 minutes. That's the kind of difference we're talking about here. But hey, that's technically both statistically significant and clinically significant, so might as well run with it. Except when they're not significant and then publication bias creeps in and we're less likely to see those studies. Cool. But that's all fine, right? Because as we learned, antidepressants have a high safety profile and low side effects, right? Right? Well, let's look at the most popular antidepressant, fluoxetine, sold under the brand name Prozac. According to the Mayo Clinic, there are some side effects, and some more, and still more. Not done yet. Almost there. That many side effects. Fun. Now that's a lot of side effects to read, so I've taken the most fun ones and put them into a beautiful word art demonstration for you to enjoy. Personally, I love when my antidepressants make my heart stop, give me seizures, make me more depressed, and make me want to kill myself. And that last one is particularly troublesome. A lot of these extreme side effects are admittedly rare, and side effect lists for any drug can be quite scary. But the increased risk of wanting to off yourself after taking antidepressants was such an issue that the FDA required a warning on all antidepressants, saying that it could make young, depressed people more likely to unalive themselves. This wasn't a warning that came for no reason. At the time of the warning, the FDA had just done a meta-analysis of 372 randomized clinical trials and found that people receiving antidepressants were twice as likely to try to off themselves when compared with those receiving placebo. Fucking kill me. If I don't do it first, Christ. But even just looking at the common side effects of SSRIs is troubling. The NHS gives this list, and there is an innumerable amount of anecdotal accounts of people feeling zombified, numbed, and less energetic upon taking antidepressants. What's more, getting off this shit ain't exactly easy. They all come with their own little shop of horrors of withdrawal symptoms. Take Effexor, for example, which is the brand name of venlafaxine, a particularly charming drug whose withdrawal symptoms can last up to several months. So let's recap. These drugs have numerous side effects, they don't work that great, and getting off them can be a living nightmare. So why are they given in the first place? We've already mentioned fiscal motives from drug companies and in some cases doctor kickbacks. But there's also the real issue that a drug being no better than placebo doesn't mean ineffective. The placebo effect is incredibly powerful, especially for things like mental health. So in that sense, antidepressants can very much work. Now, would it be better to just take a placebo that didn't cost money, that didn't have a laundry list of side effects, and that wasn't incredibly difficult to taper down from? Well, yeah, it would be. Now, to be fair, antidepressants can be effective in cases of severe depression. If your mental state is incredibly bad, almost any substance can be interpreted subjectively to be an improvement over your current state of misery. But even in severe cases, the effect is mild. And as this study concludes, the difference between placebo and antidepressants in these cases is likely more due to the decreased response to placebos in extremely depressed individuals than it is to a positive response to antidepressants. So what's more effective than antidepressants? Well, for one, exercise, which was found in a systematic review to be 1.5 times more effective at treating minor to moderate depression than antidepressants. Also, various forms of psychotherapy. The National Institute for Health and Care Research found that cognitive behavioral therapy, also known as CBT, worked just as well as antidepressants, which isn't nothing, because as we've discussed, antidepressant recipients are getting a placebo benefit even if the antidepressants don't really do a whole lot for most people. But you can't do CBT and a placebo at the same time. You can't fake CBT. So CBT and other types of talk therapy are just as beneficial as antidepressants in clinical trials, come with no side effects, no withdrawal, and in my personal opinion, are far more healthy and help people to get to possible root causes of their depression without covering it up with numbing and zombifying psychoactive compounds that change your brain chemistry on a semi-permanent basis. So why aren't things like exercise, diet, and psychotherapy recommended as first-line treatments? Well, as black-pilling as it is for me to say and for you to hear, there's no pharmaceutical money to be made in telling people to make lifestyle changes and talk to a therapist. And exercise and diet are hard things to work on when you're depressed, certainly harder than just taking a pill that is going to make you feel happy. Therapy is also incredibly expensive when compared to SSRIs. We're only recently discovering that the whole chemical imbalance theory of depression, that most people are depressed because there's just an imbalance of chemicals in their brain, is just not true. This article, written by 2 psychiatric professors from the University College London, puts the situation well. For decades, we had the false notion that a lack of serotonin was the cause of depression, and pharmaceutical companies pushed this belief to sell their drugs and make billions. People were told that their depression came from a chemical imbalance in their brain, and that taking an antidepressant was therefore no different from taking blood pressure medicine or insulin or anything else. It is now widely being understood that the chemical imbalance theory was simply incorrect. Now, this alone doesn't mean antidepressants are ineffective. Being depressed can make you have lower levels of neurotransmitters, which is why the age-old habit of confusing correlation with causation came into effect in the first place. And in theory, these drugs could work. But for most drugs, for most people, in most instances, they do not. The situation is thus. Before these patents expired, these drug companies made an absolute fortune off of ineffective pills and pushed them on doctors and into the healthcare system. In some cases, they put their thumb on the scale to make them seem more effective than they actually were, and this caused doctors, in turn, to prescribe them in good faith. Now, most of these patents have all run out, and these pills are dirt cheap. You can get multiple pills of citalopram for under $1 in the US. So we got into this mess from big pharma greed and a bad understanding of mental health, and we remain in this situation because a prescription that costs someone less than $1 a day is far cheaper than paying $120 to $200 an hour to see a therapist for an hour a week. So should you stop taking your antidepressants? I'm not a doctor, and I'm not giving out medical advice. Everyone's neurochemistry is different, and some people can benefit from some antidepressants. Also, to reiterate again, because I think it's important, placebo isn't nothing, so it's completely valid for you to feel that antidepressants help you. Now, personally, I wouldn't go on antidepressants based on the available research, or if I did, I'd make sure to do a ton of research into efficacy, side effects, and possible alternatives. This is not advice, but if someone who is depressed has the option and ability and agency to seek alternatives to antidepressants, I think it is almost always better to at least try those alternatives first, whether that's therapy, counseling, exercise, diet, meditation, what have you. I think we truly need to denormalize taking these drugs as the first thing we do when we feel depressed. It is very common to walk into a doctor's office, mention depression or anxiety, and walk out in 20 minutes with an antidepressant prescription. For those who haven't had personal experience in this area, I can see that people might think it's more thorough than it is. That there's testing done, referrals to psychiatrists, side effects, and risks explained in detail. But in most instances, this is not the case. You walk in, you talk about depression, and many doctors will just write a prescription. It's what they are taught to do, and you can't even blame them. But people themselves have the agency to take time to look into alternatives, research these drugs and their efficacy and their safety and make the best decision they can. This video is sponsored by sertraline. Why be sad when this cheap little pill has a non-zero chance of mildly improving your situation? Or why not pay a bit more for the brand name version? Brought to you by...
You know what I do? Love what? Take a big chapel like something. My hair approves over to build my brain.